I'm Dr. Jacqueline Cheung. I'm a psychiatrist from the Philippines, and I practice in a city called Cebu. They're not the same per se, but one can happen with the other. They're not mutually exclusive. And symptoms of depression and anxiety actually can overlap. Um, so that's why it can be a bit confusing. And that's why people should not self diagnose, because is it one or the other? Is it both? To go so far to say as there's a cure, no, I'm afraid there isn't. However, there is the possibility of recovery, right? So, where symptoms are not present anymore and patients are able to resume their day to day functioning, or their what we call the pre morbid functioning, which is how they were before the illness started. Because to consider oneself cured would be the elimination of the disorder entirely. We can look at this in the same way as cancer. Cancer does not necessarily have a cure, but people go into remission also. So symptoms may recur after remission or in recovery, but not to the extent of a full episode, or not so much to impair the functioning. So I think this last statement, we can say that it's not really 100% cured, because it's not completely, eliminated from our life. In my practice, it's more of the younger generation, the 20s to 30s again. And I think it would be the same trend. There is an increased health seeking behavior. I think that's an important factor that we have now that we probably didn't have a couple of years ago. They're okay already to go and seek professional help. I guess with that, we can say that there is an increasing trend of people who have consultations for this. Partly so, that is true. Depression may be due to genetics. So there are certain genes. For example, there is a gene called the 5-HTTLPR gene. So if there is a polymorphism or an abnormality in this gene, it makes one more vulnerable to depression after experiencing a stressful life event early in life, so like in childhood. There are also certain alleles in which certain combinations can make us more prone to develop depression in later life. And of course, hereditary, a family history of a psychiatric disorder is also a risk factor for the offspring to develop depression. However, genetics do not account for 100% cause of depression. So one may have the genes that would make him or her vulnerable, but if he or she would grow up in a nurturing and supportive environment and upbringing, so he or she might not develop the disorder at all. Negative or stressful life events are definitely, it's very broad, no? But I guess these several causes can kind of be put under that. So I mentioned in treatment, right? We have the biosocial approach for treatment. Also, for the cause of psychiatric disorders or psychological conditions, I also like to use this biopsychosocial cause. So the biological, we have these genes, the family history, and all those other biological components. For the psychological, we have like the own person's way of coping. If we want to talk about psychodynamic stuff, we have like the ego strength, or there's some vulnerability also there, and the social factors, which are again, which is outside the patient. So there's family, environment, school, maybe financial problems, work problems. So all of these external factors. So I guess the most common cause would be for the young would be it's like the loss of a parent before 11 years old, and in later life it may be also the loss of a spouse or a loved one. So these are social factors that can also cause depression. People who are depressed feel very sad, like very, very sad. They have a very low mood, and some might even describe it as going on for years without being able to feel anything for a very long time. So that's it's very sad and disheartening to hear. Feeling depressed is not the only main symptom of depression. So there's another core symptom called anhedonia. So it's the diminished interest or pleasure in activities that we used to find happiness in. So our old hobbies, or if we used to enjoy like cooking, going to the beach, traveling, doing these things don't make us feel good anymore. So with clinical depression or depressive disorder, we have also all these other symptoms that occur together with the depressed mood or the anhedonia. So patients may complain of sleeping too little or sleeping too much, eating too little, having no appetite, or eating too much and gaining weight, difficulty concentrating, losing focus, so especially concerning in work or school. So that would impair their occupational or academic performance and functioning. They also may complain of feeling so tired and having such a low energy that they might not even have the energy to take a bath or get out of bed, or do the personal hygiene or do their daily activities. Some may also feel restless or on edge or a little bit anxious and may feel a quickening or rushing in their movements. And the complete opposite may also occur when they feel that their motor movements are so slow, like they move so slow, probably also because of the decreased energy. So depending also on the stressor, they may feel an excessive guilt towards an event or a happening, or they may feel guilty about burdening others because of their illness or depression. And lastly, they would report an increase in recurrent thoughts of death or thoughts of suicide, and even go so far as to attempt it. So all of these factors together, definitely it impairs the daily functioning. If the person cannot take care of him or herself, cannot go to work, cannot perform the personal hygiene on their own, so that we can say that it's an impairment in functioning. And I guess maybe that's the best, most pronounced sign that we need to seek professional help for that. It's very important for the family to let the patient know that they are there anytime that he or she needs them. No, so if it holds true, let the family remind him or her that he or she is not a burden to you or the family. Because most of the time they believe this to be true, even if it's not. So constant support, constant showering of support and encouragement can definitely go a long way. So if the depressed person asks for space, and if you judge it to be safe to provide such a space, I guess they may allow it. However, it would be best to check in still every now and then. I'd also want to recommend a book to our listeners. It's titled Helping Others with Depression, Words to Say and Things to Do. So this is written by Dr. Susan Munan. It's a comprehensive guide on how family members and friends can help someone who has depression. So if our listeners have time to find this book and go through it, I think it can really teach us, ways on how to support our family members with depression.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.